Yes, your teeth will shift even after orthodontic treatment.
That's why you have to wear your retainers at night forever.
Forever and ever. Hi, I'm Dr. Areezo.
I'm Dr. Azzy.
I focus on sedation, surgery, and dental implants.
And I focus on composite bonding, veneers, biomimetics, and Invisalign.
We are the owners of LA Dental Clinic in Los Angeles, California. So there are many, many reasons why your teeth will continue to shift after orthodontic treatment.
It all goes back to etiology. That means like why your teeth are crooked the way that they are, or if you had braces, why they turned crooked again. Understanding that is really key in knowing how to fix it.
For example, if you were not breastfed, or if you only ate soft foods as a kid, you only ate macaroni and cheese growing up, that all affects how your jaw developed.
Sure, because when you are breastfed, sucking on a breast is like a lot more work. So it actually develops the muscles in your mouth and develops your upper arch and develops your tongue and puts it to the roof of your mouth.
Yes.
A lot of bottles are easier to suck on than a breast is.
Yeah.
So it doesn't develop the musculature and the shape of your jaw in the same way.
Like you have to understand that the muscles and bones of the jaw and the face are just like any other muscles and bones in your body.
Sure.
If you don't work them out, if you don't, put them under stress and pressure, they don't develop. It's as if you were born and you never put pressure on your right foot. Well, that leg isn't going to be as developed as your left leg. It's like literally the same thing with your jaw and bones. Sure. So you need that sucking motion. You need to be chewing on harder foods. That's another thing.
Right. So
that has changed.
So there's breastfeeding, but then it's not the only thing.
Yeah.
And it's definitely not the only thing that matters, right? So after that, there is baby foods. All these baby foods in jars. We understand because of choking hazards, but our food has become more and more soft, even as we're babies, transitioning into little kids.
Yes.
Like you said, macaroni and cheese.
All the kid foods.
No one's chewing on a carrot anymore.
All the kid foods are like these smushy things. Like it's like macaroni and cheese, hot dogs, really soft buns and breads. Like we've lost that like hard food, like chewing on a carrot or like really like ripping something with your teeth, like really using your bones and jaw to like, put force on it.
So this really develops how, everything forms in your mouth.
That's
right. There it is, the breastfeeding, the things that you're eating. And then there's habits, for example, pacifiers and sucking on your thumb after a certain age.
Yes, so habits, especially as we're younger, can also really shape our jaw and our bones. So for example, if you suck on your thumb growing up, the shape of your thumb will actually, like people will actually come in and their teeth are sticking out and their jaw is shaped in a certain way where they can like literally like put their thumb right there. It's like a perfect match, It's crazy.
Yeah, we can even tell which thumb. No.
We're not that good. But it's because they were doing it as they were growing up. Now they're adults. Now their jaw has like kind of set in that position.
So let's talk about what that causes. So when you're doing a lot of sucking, right, you are actually working the outside muscles more. So it actually makes your jaw narrow. So our upper jaw should be like a rainbow, like a shape like this, but it ends up being really narrow like this.
It should be like a U, but it ends up like a V, more
almost
like a V.
And that squeezes the teeth in. That's why they get crowded. And they are in an unstable position because now they're leaning in.
Yes.
Our teeth should be aligned so that the long axis of the lower tooth sits below the long axis of the upper tooth when they're straight. When our jaw is squished
let me explain that a little bit. The upper teeth to be more outside of the lower teeth. Like a shoe lid on a shoe box to kind of fit on top of each other. But when you suck on your thumb, for example, the shoe lid becomes more narrow. And so it's kind of like more sitting inside the shoe box.
Really, what I'm trying to get at is your axial inclination of the teeth goes in. So as the teeth tilt in, now the forces on these teeth is at a different angle.
That's right. Yeah.
And that can cause a lot of damage and pressure on your teeth.
Also, it can cause a lot of breathing issues. So a lot of sleep apnea, snoring, things like that are related to the constriction of the jaw and the airways. So your throat, everything becomes more narrow. So now you start having, problem breathing. And that's actually, like I was reading about sleep apnea and learning and IQ. It's crazy. Like kids, who have sleep apnea end up with like worse grades. It's not even, under their control, but it's just like from not being able to get enough sleep or not getting good enough sleep, it can affect so many aspects of your life.
It can also affect how your actual face develops.
Yes.
So people who have a narrow arch tend to, and then, compounded with maybe allergies, other issues that they might have,
Yes.
they might become mouth breathers more than nose breathers. So their mouth is open a lot, and that actually changes the way your face forms, and you end up with an elongated face, right? Those
Yes.
people who have really narrow faces, like I can tell before I look in their mouth that they're gonna have a narrow arch with a high palate and their teeth tilted in.
Yeah,
it's
just
obvious
from
just
their
from looking at their face as they're walking in.
And also a lot of times those same mouth breathers end up with gum issues because they're always, it's not moist, it's not covered. So it's always getting dried out, and you can see people with these like elongated faces with red bleeding gums and very narrow arches. So you can just look at people walking around, you can tell you're a mouth breather. No, I'm just kidding.
Yes. So there are a lot of clues as to why you have the dental issues that you have, So another thing that we should talk about is periodontal disease.
Yes. So another reason why teeth tend to shift is because the teeth are encased in the jawbone. So just like the roots of a tree are encased in the soil, the jawbone actually gives the support to that tooth. Now, if you start eroding that bone, the tree becomes more wiggly and much more easier to move.
Yes.
And the movement can be very quick. Like within, a few days, it can just move if you don't wear your retainers.
And people hit a point where they'll be like, my teeth were straight, and a couple years ago, everything started to move because the tooth is stable until a certain level of bone is lost, and now all of a sudden it becomes unstable and it really starts moving around.
It really starts moving around all of a sudden. Let's talk about as we look at people and we want to now fix these issues. So we do have to think about the etiology, like you said, why are your teeth crooked to begin with? Because once we make them straight, we don't want the same reasons to prevail. And so then it just goes back to being crooked again.
So yeah, for example, a lot of people who had braces years ago had their 4 premolars extracted, right? And that used to be a really common way to do orthodontics. So you had some crowding. So what they would do, and so your teeth were forward.
Yes.
So, but maybe that was because your arch was narrow, right? And you didn't have enough room. But instead of expanding the arch and actually making room in the arch for all of your teeth, they just pulled 2 teeth and then just retracted your teeth into the same arch shape that you had.
Yeah. I mean, when I was first taught, this is years ago, it was all about measuring the circumference of the arch.
As it is now.
And then measuring the width of each tooth, and then figuring out how much space do I need to make. And then from there, you would decide whether to pull a tooth or not. It wasn't about creating a bigger arch. It was just fitting the teeth within the same arch that you have now.
And often, maybe you needed a little bit of space, but then you have to take out 4 teeth because you can't take out half a tooth and half a tooth. So you end up with more space than you actually needed. And so you end up over retracting or over pulling in the teeth.
Yes.
And that changes the angle of the teeth into a retroclined, or teeth that are leaning in, which is unstable. It also restricts your tongue space, so your tongue ends up going further back in your throat.
Yeah.
And so that creates issues like sleep apnea for a lot of people. So,
and also a lot of jaw issues, because a lot of these were done with elastics and really pulling and really pushing the jaw into maybe not inside the socket itself.
Yeah, because your lower jaw kind of hangs off of your upper skull.
Yes.
It's like on a sling, right? And there's muscles over here, and that jaw needs to be in a certain position. And so if you retract the upper teeth, because like you said, the upper teeth are the lid to the shoebox, what's going to happen is your lower jaw is going to have to get forced back into this socket of your jawbone. And that can cause TMJ problems. So people end up having jaw joint problems. They start clenching and grinding. These people who are over retracted often grind in a forward motion. So you see this pattern of a lot of wear on their front teeth.
Yeah.
It's because their lower jaw, the musculature, wants to be more forward, but it's stuck. So it's actually trying to grind its way through the front teeth.
It's actually, you see the really flat ground down front teeth. and you can tell that it's just trying to move forward.
So why are we talking about this? And now
Yes.
you're an adult, and how do we fix this if you're having these issues?
Yes.
It's still really important when patients come in and we see all these signs and all these problems, and they're like, well, I'm here because my teeth are crooked. But we see this kind of trickle-down effect of what happened developmentally, how it was fixed initially orthodontically. And we really look at that. If we just take the teeth and rotate them into and force them into that same position, that might not be super stable. Yeah. As an adult, the options we have might be more limited, or not necessarily limited, but more difficult.
It's just harder.
It's harder. When you're a kid, if your arch is narrow, we can expand it. You're very malleable. We can make room.
The bone can still expand.
Yes.
But after, I want to say maybe 17, 18, it's much, much harder, because that seam in the top, in the palate, you have a seam in between the two sides of your bone. That seam basically fuses. There is an actual surgery that you can do where they cut that, and then they actually move the whole palate.
So it's important to know, do you need that surgery? Is your upper jaw actually much smaller structurally and that's needed? Or is it just that your teeth are inclined in, and if we just push them out, we're gonna have room? So that's why we need to look at you, understand why this happened to you, measure things.
Yes,
right?
Measure things. But the goal is to always expand, create more space for the teeth, get them in a more stable position. And sometimes we may end up with more space. So for example, a lot of cases that we do, we end up with a little bit of space next to the lateral incisors, and then we have to do some bonding or some cosmetic work to make that space. But that's because everything was so squished in. Now we're expanding. Now we have a little bit more room.
Right. And why is that? Understanding why. And often that is because of tooth size discrepancies.
Yes.
So there's so many factors involved in why your teeth are the way that they are. And we really have to look at the reason behind it before we just start rotating the teeth and squishing them into the same arch.
Yes. But having said all this, you still need to wear your retainers. We do want to look at the reason and the habits and the basically why you've developed this way, because that will dictate our treatment plan as to how we're going to position the teeth and fix it. But still, we're still not able to overcome, your developmental, your habits, if you have periodontal disease, it's still gonna move no matter how we position it.
Right.
So you still have to wear your retainers. You still have to have good health care, home care. So we're still not able to overcome nature 100%, right?
Right, but we can, hopefully alleviate a lot of the problems and issues you're having, and your teeth might move, and they may not move into the same bad position, but they may still move around. So retainers at night.
Yes,
forever. You do need to wear them.
And good health care forever. Good,
oral hygiene.
Oral hygiene. You still need to maintain the bone, everything. Otherwise, things will just move. So if you want to get a consultation with us, we do free virtuals. And we always want to consult with you, know your history. So please don't lie to us. Just tell us, because we're trying to help you. We're trying to come up with a plan that works.
The initial consultation is all about that, to understand your chief complaint, what's going on, what do you need, to really understand your history, what's happened to you in the past, and then talk to you about potential options to fix that for you. So if you're interested in Invisalign, come see us here at
LA Dental Clinic in Los Angeles, California. And don't forget, hit that subscribe button. And if you have any other questions, leave comments down below so we can answer your questions. Bye.
Bye.